Hi, my name is Amanda van der Vyver. I'm an educational psychologist at Community Keepers, and today we're going to talk about how the body is affected by trauma. Before we start, I want you to take a moment to visualize the learners you have in your class, in your school, or your children at home, and just think about them, especially those who are labeled as difficult, who struggles to focus, to concentrate, who are always busy, maybe those labeled or called out as bullies, those who have been diagnosed or labeled with ADHD, or the ones that has been referred for behavioral challenges, maybe even the ones with learning difficulties. I want us to start being mindful about how trauma can be affecting these learners, and that this behavior might be an effect of that trauma. This talk might even make you think about your own childhood and bring up some memories about that and some challenges and behaviors you are facing. If that happens, please reflect on it, and if the need be, speak to somebody. So we come across the word trauma quite often, but what does trauma really mean? It could be physical and sexual assault, any form of abuse, bullying, being a victim of a crime, witnessing violence or death, even witnessing it on television. Severe injury, chronic illness, chronic pain, being in a car accident, and also something like neglect, having an absent parent, abandonment from parents, difficult breakups or divorce, and death of a loved one. Even anticipated death of a loved one. So when somebody is terminally ill, or when you anticipate your own death, like when you are held at gunpoint and not sure whether you will survive the incident. Trauma can also mean being in a natural disaster, moving to a new location, poverty, loss of a job or a business, homelessness, harassment or discrimination or any kind of oppression, pregnancy loss, or a difficult birth, and also generational trauma. For example, trauma experienced by a parent, and we will be discussing this a bit later. So we know that trauma can have a significant impact on our mental health, but it can also affect our bodies. So today what we will be discussing is how your brain reacts to trauma, the impact of trauma in the first 1,000 days of somebody's life, and including that, we'll speak about the toxic uterus, as described by Professor Andre Venter, the effect of abandonment and neglect, and also early abuse in that 1,000 days. We will also speak about what we will witness or maybe experience because of that effect of trauma. Does a learner have ADHD or a learning disorder, or is it trauma? Is it behavioral challenges, or is it trauma? And then we'll touch on how we can help such learners or our children. When we think about how the body is affected by trauma, it's important to think about how the brain reacts. And I want us to think about three things. The brain has a lot of different parts, but we'll focus on these three things when we think about trauma. The triune brain, which includes the brain stem, the limbic system, and the prefrontal cortex. The amygdala and hippocampus, which is also called the twins of information processing. And then I'll touch on the sympathetic and parasympathetic nervous system. The brain develops from the bottom up. It starts with the brainstem going to the limbic system and then the neurocortex. If you want to imagine the brain, you can look at your hand with the palm facing you. If you do that, your wrist and your palm can symbolize the brainstem. When you close your thumb into your palm, your thumb can symbolize the limbic system or the limbic brain. And when you close your four fingers over your thumb, that will symbolize the neurocortex with the frontal cortex in front. The brainstem is also called the reptilian brain or the reptile brain, and it's at the back of your neck, on top of your spinal cord, and the most primitive part of your brain. It's developed first. Controls functions that keep us alive. Breathing, your heart rate, your basic physiological functioning, like when to eat, when to sleep. Your limbic system is the emotional part of your brain, or we also speak about the mammalian brain, the mammal brain. It registers emotional responses and is also more active when we experience intense emotion. It recognizes sensory information, so information from your senses, from the outside world, and set protective responses into motion, fight, flight, or freeze. The limbic system is programmed to bond. And I want you to remember this when we speak about the first 1,000 days a bit later. The cortex, or the human part of the brain, is where language, thoughts, self-awareness, consciousness, and memory is. The prefrontal cortex is in the front part of your brain, the frontal lobe, just behind the skin and the bone of your forehead. Executive functioning, conscious decision-making, cause and effect, and in understanding consequences for actions, setting goals, planning for the future, and behavior management is all controlled right here. This is a more slower part of your brain. It acts slower, but it's also more sophisticated. So what happens when trauma occurs? In the limbic system, remember, which is your emotional part of the brain, it makes sense of information and sets motion into action. There are two parts of information processing. The one part or path is the amygdala and the other the hippocampus. The amygdala is like a smoke detector. Its main role is to sound an alarm when there is danger. It immediately, instinctively sends messages to our muscles to act, to run, to flee. Our heart rate goes up, our breathing goes up, so oxygen can go through our body. This is a normal reaction to protect us. For example, when you touch something hot and you draw your hand away very quickly without consciously thinking about it and deciding to take your hand away. It takes over the rational part of the brain, and these messages are bypassing the prefrontal cortex. Remember, that's where decision-making can happen. So when there's continuous trauma, this alarm system can get stuck, and we enter a state of hypervigilance. We stay in this state of fight or flight or freeze, even when we are in safe situations. Because this action is so instinctive, so quick to protect us, it sometimes misinterprets cues. It's not as accurate, not as detailed. For example, you see a man reaching into his pocket to take out a phone, but your amygdala, because you're in a flight or flight reaction or state, your amygdala immediately thinks he's pulling out a gun, and you react by shouting, running, or shooting. The other pathway, the hippocampus, takes messages via the prefrontal cortex for conscious evaluation. It also helps with memories and context. So for example, if it's raining outside and it's really cloudy and you hear a loud noise, your hippocampus helps you to understand it must be thunder and not a bomb or a gunshot. When trauma occurs, your hippocampus is switched off or disabled. The last thing I want to mention about the brain's automatic reaction is the sympathetic and the parasympathetic nervous systems. The sympathetic nervous systems activate fight or flight, while the parasympathetic system relaxes the body back to a normal state, but over time. For example, the sympathetic nervous system will elevate your heart rate, while the parasympathetic nervous system will slow it back down again. The parasympathetic nervous system also disables functions that you don't need, like digestion. That is why when you enter an exam room, you feel your heart rate increases, your breathing is difficult, and your mouth goes dry because you don't need the saliva to digest something. Normally, these two systems are regulated quite well. Your sympathetic nervous system activates and your parasympathetic system deactivates. But with traumatic events, push this nervous system outside of its ability to regulate itself, and it gets stuck in this on position, a physical state of hyperarousal. If there is extreme or chronic stress and ongoing trauma, we stay in this state for quite a long time. Let's speak about the effect of trauma in the first 1,000 days of one's life. The first 1,000 days refers to the period from conception to the end of a child's second year of life. The child's experiences during his or her first 1,000 days can have long-term consequences for health and for well-being. Traumatic experiences that can have an impact on the first 1,000 days include poverty, lack of good nutrition, but also preconception. Studies show that adolescent females, the nutrition they have will affect their babies when they are pregnant later in life. Also, substance abuse, domestic violence, and stress of the mother can impact the child's first 1,000 days. Traumatic experiences in these first 1,000 days could lead to challenges in adult society, including mental health problems, obesity, heart disease, diabetes, learning difficulties, criminality, and also has an impact on economic participation. In other words, whether somebody finds a job, earns a salary, and spends money to take part in the economy. We will look at the impact during pregnancy, the effect of neglect, and also the effect of the early abuse in these 1,000 days. The toxic uterus. Professor Andre Venter from the Free State is a specialist in pediatric development and child health and has developed this concept of the toxic uterus. It refers to the environment in which a fetus must grow, but is also dependent on the physical, emotional, and psychological health of the mother before conception. Maternal stress, so prenatal exposure of stress to the baby, impacts intrauterine growth, leading to health problems such as obesity and diabetes in adulthood, as well as learning disorders and an increase in ADHD-type symptoms, challenges in cognitive and language development, behavioral and emotional development, and again, like ADHD-type impulsivity and risk-taking behavior. Also an impact on neuromuscular maturation, like dyspraxia, where somebody struggles with movement and coordination that will present after puberty. The impact of emotional or physical neglect is also quite significant in the first 1,000 days of a child's life. Remember, I said that the limbic system is programmed to bond with somebody, and therefore, if that does not happen, it is a disregard of a child's basic emotional needs. A study with internationally adopted children showed that there was a link between the duration of early attachment deprivation and the levels of ADHD-type symptoms. In other words, the longer it took for a child to be adopted into a safe, loving home, the more ADHD-type symptoms they showed in adolescence. We also see that securely attached children shows less attentional problems, and this is also linked to cognitive dysfunction, atypical brain maturation, and disruptive mood disorder. Early physical and sexual abuse or exposure to parental domestic violence before the age of 2 showed increased levels of cortisol and catecholamine levels in the child's body as a response to these stressors. This is linked to destruction of brain cells, disruption of normal brain connections, affecting the child's behavioral development, and also sleep disturbances like night terrors and nightmares. This is also linked to ADHD-type symptoms, and a 2-year-old child usually reacts to these stresses with anger and emotional expressions or feelings of distress and frustration. When there is persistent activation of these stress responses and no resolution of the stressor, we will see immune deficiency, cognitive impairment, inhibited growth, delayed sexual maturity, psychosocial maladjustment, hypertension, and visceral obesity. When there's more trauma later in life, thinking back to that list of traumatic events that we spoke about, or continued stress and trauma on top of this trauma in the first 1,000 days, you can imagine that it can lead to an escalation of the brain and the body's stress response. What will we witness then or experience ourselves? ADHD-like symptoms where medication might not help. Disruptive mood disorders, chronic health conditions, somatic complaints like stomach aches, sleep disturbances, so you'll see a child that struggles to wake up or a tired child in your class, gastrointestinal and urological problems, cardiovascular, respiratory, musculoskeletal, and dermatological problems, and neurological challenges. So how can we help? What can we do? I think it's important to acknowledge and to remember the effects of traumatic events on our children and our learners. Not just bad behavior on purpose. It's not just somebody who's not interested in their schoolwork. It might be trauma. We have to re-engage the prefrontal cortex where learning and decision-making in language happens. We have to help to calm down the parasympathetic nervous system so our learners aren't always in a fight or flight state. We can do this by grounding exercises, so letting them count to 100 or to 20 or to 10, depending on the developmental stage. Or like Christine spoke about in the anxiety video, we can name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. If you take a learner or a child through that exercise, it helps to ground them, to bring them back. We can help with breathing and meditation exercises, and also with mindfulness activities. These are easy activities to do before you take your child to school, or in the afternoons before you start with homework, which might be another stressor in this child's life, or in class before you start a new lesson, or after break, or you see your children are not really there. We have to re-engage our learners and our children to help ground them, to bring them back, to help them focus. If you have questions about this or you need some tips and resources, please visit our Seeker offices. We will be glad to help. Thank you.